The TMJ TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified. I am Tony Urbanek. Today, the topic is fact-checking TMD, TMJ. This isn't the next in a series of fact-checking articles, videos that I'm producing regarding TMD, TMJ. The reason because there is so much unfactual material floating around about this disease and has been for 60 to 80 years or longer. And if you want to know the history, if you want to know all the details of the disease, please refer to earlier podcast episodes. Today is the third in a series of fact-checking about TMD entitled Talk Therapy. In other words, talk therapy has been used by others for some time as an important treatment for this problem we call TMD. So a quick review, because I am becoming well aware that viewers on this podcast include public, not just doctors, which is okay with me, except I really hate to use language or technology or words that are not easily understandable by the public that should be understandable by doctors. But let's define a few things first of all. Let's define the term. TMJ itself is, TMD, TMJ, is a series of symptoms, which include headache, earache, jaw pain, neck pain, ringing in the ears, subjective hearing loss, fullness in the ears, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking. That is what TMD is. It's a series of symptoms. There are other people who put definitions to it, but that really is the correct definition. And one of the confusing parts is that those symptoms are so confusing. They don't seem to hold together, which was the whole point that was discovered. The common denominator of TMD is chronic inflammation in the joint. And if you can decrease the chronic inflammation in the joint, then the symptoms take care of themselves. They go away. That is what has not been understood until recently discovered by me and disseminated and talked about. Talk therapy is simply a method used by psychologists and psychiatrists to back and forth communicate with people who suffer some or all of these symptoms so that those symptoms will decrease and be limited. The question is, how does talk therapy decrease chronic inflammation within the temporomandibular joint? Or what is the theory that that might happen? So, as I've talked to also discussed before, every week I produce two parallel groups of information. One is a blog, a written article on a blog, which is directed directly to the public, and I try to make it easily understood for public. And then 2 days later, I do a video almost exclusively on the same topic, but directed to dentists, physicians, but primarily dental professionals who attempt to treat TMD, TMJ. So this week I produced a 2-page article on checking TMD, TMJ, part 3, talk therapy. And so please excuse me, but I'm going to use at least part of this article in discussing this with you to make it thorough and complete, because this talk therapy, well, I'll let you decide for itself. So the logic used to validate talk therapy, this is directly from my article. The logic used to validate talk therapy for treating TMD, TMJ is as follows. Here's the logic that is behind it that the psychologist and the psychiatrist and some people in the TMD treating industry use to validate what they're doing. Number one, bruxism, or clenching and grinding of the teeth, is one of the 3 elements that can damage the temporomandibular joint. The 2 others are acute trauma and functional malocclusion. That is a true statement. There are only 3 things that cause damage to the temporomandibular joint, and they are bruxism, acute trauma, and functional malocclusion. 2, if bruxism is one of the causes, then anything that limits bruxism should decrease symptoms. Well, that is a true statement too. It is generally accepted that bruxism, clenching and grinding of the teeth, is related to stress and anxiety. That is also an agreed upon statement. The only thing we know about bruxism, it is related somehow to stress and anxiety. It is an accepted statement on that issue. Number 4, therefore, if you can decrease stress and anxiety for the patient, the TMJ symptoms should be resolved. Well, I guess if you can decrease all of a patient's stress and anxiety, and they never had stress and anxiety again, then theoretically you would not have any purpose to brux your teeth. Number 5, a properly trained psychologist or psychiatrist can talk with and counsel a patient about stress and anxiety to the point that they no longer have stress and anxiety. That's where the logic falls apart, because that doesn't happen. That is where the logic falls apart. So here are the facts. We're fact-checking, and here are the facts about talk therapy. The exact mechanism within the nervous system that converts external stressors and emotional anxiety into bruxism is unknown. That is a fact. We have no idea what translates or creates bruxism, too much clenching and grinding of the teeth, from external stressors. We know where it happens. It happens somewhere inside the brain, most likely in the brain stem, and I won't go through the reasons why it is most likely there. But we have no idea how stress and anxiety creates bruxism technically. We know there's a relationship. So that's a fact. There is a relationship. How it operates in the brain stem, how it operates within the brain, we're only guessing. Only guessing. Number 2, everyone on the planet experiences external stressors on a daily basis. Some people deal with stress and anxiety better than others. Well, that's a true statement. I think everyone would agree with that. Number 3, one's ability to deal with stressors varies on a day-to-day basis depending on hundreds of factors. Well, if you have stress and you live on planet Earth, or let's just say if you live on planet Earth, you have stress, and it should be real to you. Some days you deal with your stress better than others. I think that can be an agreed upon point, depending on your level of sleep, your level of use of substances of various kinds, including alcohol, drugs, even sugar. I mean, look at what happens when you sugar up your grandchildren. Do they act different? Yeah, I can attest to that. One's ability to deal with stressors on on a daily basis depends on hundreds of factors. Talking about one's stressors and emotional anxiety sometimes makes things better and sometimes makes things worse. Think about that statement. I think that everyone would understand that talking to your spouse about your conflicts or your children or your friends sometimes makes it better, but sometimes does not resolve the problem, and at times can actually ignite further stress and anxiety. So talking always doesn't do the job. Talk therapy has no effect on the other two elements that cause TMJ, TMD. So talk therapy, talking out your anxiety and stress to delimit or limit your stress and anxiety, has no effect on the other two causes, which are acute trauma, auto accidents, kicked by horses here in Tennessee, fall off a ladder, and then, of course, functional malocclusion, the patient has no control over. That has a lot to do with facial growth and development, of which I feel I have a lot of experience in studying and treating. Talk therapy is a continuous, never-ending cycle of support that must be followed consistently to have any effect at all. Consider the use of the 12-step method for alcoholism, which must be applied indefinitely. So, talk therapy with other people affected by alcoholism is known and agreed upon to be effective to some degree. And I assume that some of you listening have actually used that method and found that it is effective to a point, but it is a continuous method that must be adhered to continuously. It is not a one-all, fix-all thing that you do a few times or even multiple times. It has to be administered continuously if it is going to be effective at all. And we also know that, unfortunately, the 12-step method is not effective for everyone, although it is highly recommended, as I would recommend it. Bruxism is an involuntary mechanism within the body coordinated by the autonomic nervous system, which also controls breathing, heart rate, and gastrointestinal function, for which we have no control. So basically, bruxism is controlled, constant motion, whether it be of the jaws, whether it be of different medical diagnoses, different medical problems, is controlled by the autonomic nervous system, and we do not have control of the autonomic nervous system. So we do not have control of bruxism. So ultimately, talk therapy has no significant effect on relieving symptoms of TMD, TMJ. It may, admittedly so, have temporary effect on a particular or group of stressors or anxiety. I will admit that that may have some very good effect, but you can't get locked into continuous talk therapy to handle bruxism, because, again, if you live on planet Earth, you will be stressed. At times, you will be stressed more than others. And it's a losing cause to try to get somebody to quit clenching or grinding just to decrease a stressor or two. And some stressors, the most common ones that I hear, here are the most common stressors that I hear now doing consultations with over 5,000 people, 4,000 people treated, because some people don't go through treatment. Most common ones that I hear about are traffic. And since the majority of TMD patients are females, it's the females that come in and they will admit that they have learned to treat their TMD symptoms with an oral device that unloads the temporomandibular joint and decreases the inflammation within the joint, they've learned to put it in when they're in traffic. And it doesn't decrease the stress of traffic. The traffic is still as stressful as it was. And I'd like to see a psychologist get someone to decrease their stress about traffic. Traffic here in Tennessee, Middle Tennessee, is getting worse every day, literally by the day. And the other stressor that I can relate to, and that is sitting at the computer. Ladies also come in and they say, I've learned to put this thing in my mouth when I'm sitting at the computer. So what you're doing by unloading the joint is not decreasing stress. What you're doing is unloading the joint, allowing the inflammation within the joint to go down, similar to a set of crutches would unload the knee to allow the inflammation in the knee to go down, or a sling would allow the inflammation in the elbow to go down in cases of tennis elbow. It's as simple as that. It's not complicated, but you have to have the right device and you have to follow the right protocol to have that happen. So, back to the topic and back to the purpose of this episode. Fact-checking, part 3, talk therapy. Now, I am personally familiar with 2 large universities, which will go unmentioned, unnamed, that brag on the fact that they have psychologists and psychiatrists brought into the consultations with patients who routinely come into their services, university services, basically large dental schools, for the treatment of TMD, TMJ. My opinion is that that's wasted time, wasted money. And in my opinion, everything else I tried to bring to you in a factual manner, but next thing I have to say is my opinion. My opinion is that universities that use psychiatrists and psychologists for talk therapy to treat TMJ, TMD, simply do so to appear more academic, needlessly inflating the number of providers necessary to treat the patient. That is my opinion about those who try to treat TMD with talk therapy. But it is very common, and it is promoted in certain areas of the country and in certain universities, and I fully disagree with that. And I'm ready to defend my position to anyone who would like to convince me otherwise, and I am open to communication and discussion to anyone who would like to discuss it with me or criticize, for sure. I can be reached at tony@tmjservices.net, our website, which encourages doctors to join the network who use a very simple device to unload the temporomandibular joint, decrease inflammation in the joint, and make all of those noted symptoms go away. We have a study to prove it, an independent university study to prove that. And part of treatment is not talk therapy. So I hope I made the point on this episode of TMD Demystified on fact-checking the value of talk therapy. I look forward to hearing from you at any time. Until next Tuesday, I will have another topic. It's going to be in the series, continued series of fact-checking regarding TMD, TMJ. I am Tony Urbanek, and this is TMD Demystified.